Assalamu alaikum. Good evening, everyone. My name is Mr. Ali. As always, it's a Thursday evening, 8 o'clock, and the real story is coming through to you via ZMC Network. Unfortunately, it has been a tough time for all of us, and we are going still through high numbers of COVID. And I always start my show off by giving you the latest COVID numbers for Birmingham. So gradually the figures are coming down, but not as quick as we would like to hope and pray. So this week, in terms of the numbers for Birmingham, it is 3,328. That compares favourably with the week previous of 4,487. What does that mean for per 100,000 of population? 291 cases per 100,000 population this week versus 393 per 100,000 population. The following 7-8 wards have the highest number of COVID positive cases. So if you have family yourself reside in these, please continue to maintain social distancing and do not frequent in anyone's home. So Yardley East is leading the way, 647 positive cases per 100,000 population, followed by Stetchford. After that, it is King's Standing, which has 418. Heartlands Ward, which has 411 cases per 100,000 population. Erdington, after that, of 410 cases per 100,000 population. Sparkbrook, Borsal Heath, which has 409 cases per 100,000 population. And at the end, we have Birchfield, 406 positive cases per 100,000 population as well. Okay, so today's topic is all about COVID-19 in residential care homes. This is a topic that I wanted to cover for a number of months, but for one reason or another, we weren't able to get this program to you. And as we know, people that are residing, that are in residential care homes, these are people of a elderly, of a frail, of a vulnerable underlying health conditions nature, and these are people that are normally at the end of their lives as well. And these are also people that had suffered the most, both in terms of contracting the virus, also in terms of not being able to see their loved ones, but also in terms of paying the ultimate price as well. So today I have the lovely Salma Jussab, who is going to help me talk about and shed light on this particular issue. So warm welcome to you virtually, Salma. I hope you're well. How are you keeping?
I'm not too bad, thank you. Just going through the challenging time like everybody else is at the moment, isn't it? And just riding the storm with everybody. So I'm good, thank you. Yourself, you're okay?
Yeah, very good. Thank you. Alhamdulillah. So today we're talking about COVID-19 in residential care homes, something that you've got a insight and you've got some experience. So thank you for coming on to the real story. I mentioned earlier, right at the start of COVID, if we go back 11 months now, one of the key places where the risk was high, people were suffering in terms of the number of positive cases, the number of people that actually left hospitals without a negative COVID test and discharged into residential care homes was enormous. But at the same time, the support and the PPE equipment was simply not coming through. We had a number of care homes, a number of healthcare assistants and managers really, putting messages on social media. That's how bad it was, saying, look, we're in urgent need of PPE. What's your recollection? Time of around April, May, when, for love of money, you couldn't get hold of PPE equipment.
Yeah, it was challenging times because I crossed over between residential care and as well as community care. So I sort of sit between the both of them in that respect. And it was And I think one of the biggest problems was, I think, when the outbreak was starting right at the beginning, when we were all facing this pandemic that none of us knew about, I don't think anybody was prepared in any way whatsoever in regards to what was expected, what the outcome would be. And I think a lot of us, and including me, I mean, I'll put my hands up as well, when I was hearing about this right at the February, because it was around this time last year we were hearing all these things, wasn't it? And it was like, we've been through some of these challenging times ourselves, haven't we, with SARS, Ebola and things like that, where we had to prepare ourselves, there will be an outbreak of this or this will happen, and then we know there's been a solution. So it was one of those things where I think it was hitting us, but none of us were really prepared for it. And I don't think the government was prepared for it either. And the reality of it all was that it all went to the hospital, wasn't it? NHS, the hospitals were getting rammed with people, and again, nobody knew how to treat these people with COVID as well, wasn't it? Because it was an ICU unit straight away. Nobody understood any of that. So I think the impact was high, but because the focus was mostly on hospitals and admissions and things like that, the community care and the residential care completely got put on the side. And it was, I think, a couple of months down when the outbreak happened, wasn't it, in one of the areas where they started people dying in care homes, and that's where the government realised that they had forgotten us out in the community. But since then, I would say they have put measures in place. Things have improved, and we're not sort of so much at the end anymore. The sort of focus is NHS plus social care. So you're looking at health as well as social care now to bring that tied in together, basically.
Yeah, I mean, I remember the slogan about protect the NHS. So every Thursday we used to come
Yeah.
and clap for our NHS colleagues, but at the same time, only 10% of PPE actually managed to filter through to residential care homes, which is just simply not enough. And
No.
that changed when you mentioned that we had a bit more data and a lot more deaths occurring in care homes. For me, something that was completely negligible was actually hospitals. You understand that they were overrun, they were beyond their capacity, but to simply discharge patients from a COVID test, and that's where I think the whole positive cases really mushroomed and ballooned when these patients that were positive went and passed it on to their other sort of residents sharing the same home, and because they had underlying conditions, because they had dementia, because of their age, it was almost like wildfire. It just the positive cases just spread, and huge amounts of people were dying. Literally, I mean, I remember at that time reading a testimony of one healthcare assistant, and she was saying that we would either do the night shift or finish our night shift. And when we used to come back in the morning, it was almost like, 4, 5, half a dozen of our patients in our residential care home had simply passed away overnight. And that was just almost normal at that time.
Yeah, no, totally, it's true, totally. Because one of the mistakes was, like you say, the lack of communication, I would say, between the hospitals, in the discharging teams back into the community, as I call it, whether it's residential home or people going back in their own homes. But it was lack of communication in that respect, giving the proper information. And because the bed were getting blocked up and everything, it was easy to just discharge everybody and anybody to free up the bed space, but not realizing those patients who were probably already in hospital or coming into hospital were COVID positive, and nobody was picking those up. And this is where the outbreak of the spread came. I mean, one of the cases I remember dealing with, which was really, really sad right at the beginning, was somebody we were looking after. You there?
Sorry, carry on, carry on.
Yeah. Yeah, somebody we were looking after who was discharged from the hospital again, very, very poorly, but we weren't told she was COVID positive. But she ended up infecting her own 2 sons and her husband, and ended up losing both of her sons, who were under their 40s, I think, at the time, no underlying health issues, and they both passed away. And it was a horrible situation. Like you said, one of the health workers who was talking about it. These are the realities of in homes symptoms we were seeing as well. You know, not enough PPE around, not enough guidelines for us, or not even support. You know, to who do you go to for some guidelines and some support around the situations you're facing realistically. And I know they were talking about shortage of staff in NHS. You know, they needed to bring staff over, you know, and get nurses in the hospitals and things. But in social care, we were having the same issues, because if we had about 4 staff go into isolation or go off sick, you know, because they've got COVID, then there was no replacement. So who provides the services? You know, so it was a mixture of everything happening together. But like I said, you know, NHS was getting, the health was getting more focused, but social care was getting missed out completely in that.
Absolutely.
So the dynamics were the same, you know, regardless of whether you were in hospital or community care. Even now, to this point, coming 11 months down the line as we're talking, we're all in the same boat. You know, when if you think about it, if the alerts are going on for hospital that they're overpacked, the ICU units are really, really jam packed, and the hospitals are really struggling, then you've got to see the impacts is coming in the community care, because the hospital discharges start off, and then what they call the step 1 and step 2 system, isn't it? Step 1 is to prevent people going into hospital. So when you're preventing somebody from going into hospital, then you're obviously applying community care out there, residential nursing homes, people in their homes, and staff are put at risk in those areas as well, because they're going out to support somebody with COVID, but you know, in that dilemma.
Most definitely. And we have seen over 110,000 people have now paid the ultimate price with regards to deaths from COVID, and a significant, at least 25% of those have occurred in residential care homes. So you're looking at around 30,000, which is just an astronomical figure. I remember there were some predictions at the early onset of COVID, where people were sort of, you know, doing some modeling around the number of people they would expect to die. And at that stage, you know, there's some scientists saying we expect by the end for, you know, 100,000 people pass away. And I was thinking, you know, where did these get these cracks from? How are they coming with 100,000? But almost a year later, we've exceeded that, and we're, you know, one of the leading countries in terms of the number of people that have passed away as well. And for me, also the fact that at the moment healthcare professionals, the ones that you're talking about, haven't still been vaccinated. You know, only around 60% have been vaccinated, 40% still haven't. These are your key workers that should have been priorities, and there's no excuse for not to. So in your experience, I mean, for some of your colleagues that you are working with, how has that been received?
Right, the problem you've got here, you can't fault the government here, to be honest with you, because I know we're receiving all the support around vaccination on a daily basis. You know, there's so many access available for staff to be able to book themselves and go and get themselves vaccinated. You know, they can do that, and they're opening a few more hubs for us locally as well, and they're giving us other material as well, in the sense of like to how to answer the QAs for the staff if they've got any questions around why they should have themselves vaccinated, you know, that kind of work. But again, the situation we're all under, isn't it, is a negative press releases and negative that's following us all the time, isn't it? And this is where the biggest problem and the biggest hurdle sits for all of us, because a lot of them obviously don't think that they need to have a vaccination, because they feel that, you know, it'll cause more damage to them than actually prevent anything,
Sure.
in that sense, you know. And I mean, in fact, I was talking to one staff yesterday, you know, trying to understand, you know, trying to do one-to-one meetings with them and have a chat with them to see why they don't, especially when we're in the front line, like you said, you know, we're at such a high
Absolutely.
risk. And those of us who have had COVID, you know, we wouldn't wish it on anybody else, because it is I know a lot of people turn around and say, oh, it's just a normal flu, or you know, you'll get over it kind of bit. But I can tell you, for the amount of people I've known who have actually got COVID, has left them with the long-term health issues as well, although they've been fit and well. I know somebody who had a knee operation about 2 years ago and caught COVID, and I was talking to him the other day, and he goes that his knee problems have started again. It's triggered, but he doesn't know what's going on. And then I know somebody who was a registered manager she got COVID by going out to help somebody, and she was hospitalized, and she's discharged from hospital with a lung disease. Apparently, it's damage to lungs somewhere. So, COVID is a very, very dangerous illness at the moment, and not many people know about it. And trying to understand why nobody wants to get vaccinated, it doesn't make no sense at all. And like I said, I was talking to a member of staff yesterday to understand why she didn't want. She's got some health issues, from what I gathered from her. But again, it was more about we don't know enough research on it. What's going to happen with it? You know, what will I end up with? It's those kind of thing. And then when you go on social media and look on, so it's so negative. You know, it's like I feel, from my point of view, I might be speaking a bit personally. I feel like everybody's becoming an expert in this, whereas everybody should be following the government guidelines, public health. And the other thing I always
Absolutely.
say to the other thing I always say to staff when I'm talking to them as well is like, if we were rushed into hospital and something's happened to us, we collapsed, and we were rushed into hospital, we never know what drugs they're giving us, because the only thing is about to survive us and make us stable. We never check what drugs they've given us or how long they've been
No,
tested for, things like that.
no.
It's the faith we have, isn't it? So again, with vaccination, you know, we're all looking for a solution, and this might be our solution, you know, at the end of the day. And if more of us don't get vaccinated, we won't come out of this, because this is going to be life for all of us. And after effects, I mean, so many people have had it by now, you know, so many. And there hasn't been, you know, I mean, the staff ratios I work with, everybody's had, most of them have had it, to be honest with you, after talking to
No.
them and having one-to-one meetings with them. So they have had it. But again, there's been no reactions at all, apart from a bit of a sore arm when you have a flu jab, or, you know, a bit of a temperature they've had, which paracetamol can't cure, you know. So, but I can't fault the government. Like I say, you know, everything's available to us out here in the social care part of things. Availability, material, literature, anything we need for the staff to, you know, to understand why they should have it. But it's the negative press that people are following at the moment, which is putting a lot of people at risk as well. I mean, we've got a responsibility to get our workers vaccinated, but we can't enforce it because of human rights and things like that, as we all know,
Absolutely.
unless the makes it mandatory. If they don't make it mandatory, we can't do it. But this is why, you know, you're going back to your question where you're saying, you know, vaccinations are about why certain workforce haven't had it. Those are the barriers. Realistically, it's the staff choices.
Yeah, no, thank you, Salma. And I think this is the vaccination rollout has been a real success story. We are the
Yeah.
second leading country in the whole of the world, the leading country in Europe in terms of the number of people that now we have vaccinated in our country. And you know, in terms of the rollout, it was done on a priority basis, and those people that were more vulnerable were given the highest priority. So at the moment, we know that 95% of people over the age of 80 have now been vaccinated. 90% of people over the age of 70 have been vaccinated as
Excellent.
well, and these are primarily the cohort of people that we find in residential care homes. And it makes sense as well, Salma, because if you vaccinate 10 people in a care home with those sort of background and characteristics I've just mentioned, as well as dementia and underlying health conditions, you ultimately save one death. If you vaccinate 100 people in the general population in the community, that saves one death. So the ratio is 10 to 1, and hence why it makes absolute sense. The other thing I was just going to touch on was regard the point that you made about the rollout in the staff. I mentioned 40% of the healthcare assistants or people that are working in care homes haven't still received nationally their vaccine, and about 7-8% of those have actually declined it. But from the conversation and the experience that you're sharing, it seems that the ones that are declining and have concerns about the evidence base for these vaccines seems to be a bit more higher, and they are legitimate concerns by some of your colleagues.
Repeat that again. Sorry.
So just the mention about there seems to be a real concern for some of your colleagues about the long-term evidence about the vaccines, and hence why there seems to be a higher rate of decline for not receiving their vaccination.
It's because when the vaccination was being, I think it's more to like I go back to the media and all the negative side of it all because at the time, if you remember when they were talking about the vaccinations and they were talking about doing the trial studies and things like that, there was a lot of negativity around that, wasn't it? Because it was like the government's doing a half jobs and we're the guinea pigs and we're the ones who they're testing and then obviously there was conversations when you have a vaccination approval, it takes about 10 years before it's approved and those kind of things has not helped a lot of people. And then the other myth around it all, as I found when I'm talking to the staff around why they won't have vaccinations and things, some of them feel because they've already had COVID and because they've built the antibodies against it, they don't think they don't think they need a vaccination, and which is not true either because nobody
Absolutely.
has done any test, have they, around whether you can't have it again, and none of us know how long these antibodies will last in our bodies either, do we? So there is no
Yeah.
real evidence around that either, is it? So it's a mixture of everything, in but what I am finding, if I'm honest with you, I'm finding a lot of ethnic minority people from the ethnic groups, BMEs as we call them, are the ones who are really highly declining the vaccine. And when you look at the stats and everything, we're the vulnerable group, we're the ones.
Absolutely.
I know we're looking at the vulnerable adults and we're looking at health workers, the frontline workers and anybody with clinical illnesses, underlying health issues who become vulnerable, so they got to be vaccinated. But if you look at the stats as well, we are we are in that high category as well. But when you look at the decline side of stuff, it's again from the ethnic groups, and again, don't really understand why there is a refusal around something that can help and prevent. And the thing about us as an ethnic groups as well, we live in extended families and things like that, don't we, as well? So we are living with our elderly and vulnerable people under the same roof as us, and then we are working in these fields where we are coming and going, shopping calls and all sorts we're doing, on a daily basis. So we should be even more cautious about protecting our elderly people and vulnerable people we're living with. But it seems to be a high decline in those, and in the staff ratios as well, we find is the same thing. The ethnic groups are where the decline is.
So, some I would have hoped that people that you are working with and you're managing as well, who have a real insight into the medical professional, they work with healthcare professionals all the time, that they may have been sort of a bit more inclined to take up the vaccine, but it seems as though there's also a bit of a confidence gap there as well. So I understand and take on board your comments, and viruses do change, they do sort of mutate. So just because you've had it once doesn't mean that you won't get it again as well. So I think we need to, and in my various platforms in my own capacity, I have worked very hard over the last 2 months to debunk some of those myths. But still, despite all that, with the imams now, with the Muslim and the Asian healthcare professionals, as well as politicians coming out and encouraging the Muslim and the Asian community to update. Excuse me, we're still lingering around 45%, and that there's still, and that compares around 85% for the general population. So we're about half of where we need to be. And then if you look at people that are younger, people that are of the female gender, their percentage within that BAME community is even lower than that 45% that I've just mentioned. So I think a lot more hard work needs to be done, most definitely. Moving on now, I know just going to talk about some of the physical, mental, and the social impact it's had on, not only on the healthcare professionals, but those people that were residing, because, when COVID first came in, there was a lockdown and there was a overnight complete stop for anyone to go and visit their loved ones in care homes, whether it was your your sort of your parents, your uncles, your grandparents. And for many months they literally had no visitors. And we know the elderly population, especially those from the AME community background, aren't exactly IT literate savvy, so they weren't able to do FaceTime, or maybe even forget FaceTime, Sam. Even the normal sort of smartphones, sometimes they have real difficulty in actually using those, and they were completely cut off from the outside environment. And you can understand why, But again, for someone, you want to be in contact with your son and daughter. You want to say hello, and we are social creatures. But at that time, it was very difficult. So, what insight can you provide at the human toll that it took on some of those people living and residing in care homes?
Well, it was tough. As you know, it's tough and it's heartbreaking as well because at the end of the day, those of us who are in this field, we are really in there because we care. We just want to make that difference, isn't it? It's not, let's face it, it's not one of the well-paid jobs in the world either, is it? That way you're making
No,
millions of money. But the reason you're
no,
in that
no.
field is because you really care and you want to make that difference and you want to see that smile. That's what you're really in there for, in all honesty. So it was really, really heartbreaking, but it was about us thinking outside the box, really. How do we support them? We became the best friends, although we were like, care workers and, we were there to look after them and support them. But obviously the relationships got built more, where we were supporting them, like you're saying, IT savage and things like that. But we were their IT, supporting with FaceTiming so they could actually see, their loved ones and have a conversations with them, trying to organize
Yeah,
some sort of activities and things like, keep them entertained, give them the news, give them that time to spend, not like, because normally, as you know, in care homes or in the community care, there is a very limited time for any of the staff to be able to spend that luxury time with people, in that way, because there's so much, you have to follow and do. And if one person gets ill in a residential home, as you know, with the staff ratios and things, it takes a lot of your time. But that had to be obviously re-looked at and make sure that we were available there, and we still are. We're available there to give them that time, help them with those IT things, able to make those phone conversations, so they didn't feel completely hostile and they didn't feel completely, that all of a sudden, the world's changed and we
yeah,
can't see our loved ones and things like that. So it's about thinking
yeah.
outside
I
the
mean,
box, really.
definitely, and I think yourselves really made an effort. And I remember at the height of the summer when lockdown actually sort of was lifted, people were still weren't able to, when they saw them, they had a screen or a pod so you could
Yeah,
sort of see each other and speak to each other, but unfortunately they weren't able to give each other a hug as well, and
yeah,
there were some real desperate stories. And I remember one case that was still stuck with me was the husband wasn't able to see his wife for 45 years, I believe. And what he did was, after about 6 months, because he really missed her, he admitted himself into the same care home just to
mm,
be with her. And I thought that was so
yeah.
sweet. And what a wonderful touch as well. And, he has been difficult. I'm just going to go through some of the questions that people have sort of been sort of making as well on social media. So, Assalamu alaikum, Mr. Ali and Salma. Great show. Abid Khan's just given you salam and giving you his
Walaikum salam.
regards. Yeah, Javed Akhtar, Assalamu alaikum. I can't understand why the government did not take COVID-19 seriously in care homes at the start of the pandemic. Lack of intervention cost lives. I think we've sort of touched on that, haven't it? I
We did,
think
yeah.
they almost sort of put all the resources into the NHS, and this was almost like something bit of an afterthought. But when they did get it, they did get it right. But I think by that time it was, I would say it was a little bit too late. But by that time there was maybe some
It was in a way,
untold
it
damage
was,
that could have been prevented.
yeah, in a
That's
way,
right.
it was a
That's
bit
right.
late, but the main thing to put it right for us.
Yeah, I mean, and hindsight's a wonderful thing, isn't it, Samba? Because I know,
Yeah,
if me and you were at the helm, there's sometimes you make decisions and not everyone's going to agree with you as well. So it
no.
is an unenviable position as well. Javed has followed up by saying, "Can you confirm that COVID-19 deaths in care homes are counted in the normal stats, or are they
Yeah.
documented separately?"
No, everything's counted for because what the government has set up for all of us now, which is a good thing, portals. We all got portals. There's public health portals, government ones, and there is CQC as we're regulated by those standards. So every day we got daily trackers that we have to complete and put in there, and information like deaths, if there's anybody that died with it, COVID, we have to complete that for public health. Any positive outbreaks we've had, any pay service users that might be COVID positive, we're looking after. We have to log that, even if care staff had to go into isolation or were COVID positive. So everything gets documented on a daily basis. We have to submit. There's about four different trackers we have to submit, and they go on a daily basis. So the figures you are seeing out there are true figures, I would say.
Yeah, thank you. And I think the
Providing
way the
everybody's
that's
providing everybody's completing the figures. At the end of the day, as you know, we're all in silos, we're all working separately, but we are governed to do that on a daily basis.
Yeah, most definitely, Sam. And what I would also say is that those deaths are, if you've had COVID positive in the last 28 days, it then gets recorded in your death certificate as well as a cause of death. So that's
Yeah.
just the way it's done. So, okay, to date, out of the reported deaths of over 100K, how many of these are attributable to care homes? Javed, I think what we said was around, it's estimated around a quarter of all the total deaths, 110,000, are now attributable to care homes. So we're looking around 30,000 deaths in the UK. I hope this answers your question. I think people couldn't see their loved ones during the start of the pandemic in care homes. This caused a lot of mental torture and anguish for the families concerned. Absolutely, and I think we've alluded to that as well. I know in the Asian community where we look after our elderly in their own homes, even in their old age. I don't know what percentage of our community are in care homes. I think it is, I mean, correct me if I'm wrong, Sam, but am I right in saying that it's probably lower in terms of percentage compared to the overall UK population?
It is probably lower, but I would say it's on a rise as well, if I'm honest with you. We're
Absolutely.
seeing more and
Yeah,
more,
yeah,
yeah.
yeah.
Yeah. Especially around, I would say if you go around Leicester and that, because I know sometimes when, 'cause like I said, I sit in a community as well as residential, I sit in both. And then when there is some service users, as we call them in the community, do need that care in residential home, the general is they will go into Leicester or Birmingham or somewhere around those areas, because the care homes are very limited for for Asian community to be catered around that as well. So, but the rise is there. I would say it is getting slightly higher than what it used to be.
Yeah, no, that's fine, and also in one way it is the right thing. I know we see that it's our sense of duty to repay the favor and look after our parents, and it's a privilege when they are old and vulnerable. But there are certain conditions that need an expert to
Yeah.
look after them. Rolling over, having sores, the medication. Unless you have that expert support mechanism around you, it is very difficult. As you know, just moving someone, from a sofa to a bed, and especially if they have to sort of maybe possibly go upstairs, that's more risky as well. So I think the attitude towards a good care home are really changing.
Yeah, it
Um,
is. Yeah, it's becoming more. I think people are becoming more acceptable now. Especially in the Asian communities now, isn't it? That there is more options available than for the person they're looking after is suffering, and they're suffering as well. Because, like you say, social care in the community is very limited. What you can get, unless you're in a residential home, kind of thing. And for a family to look after somebody who's really terminally ill or requires a lot of intense care is not easy. So I think it's become a bit more broad now. People are the mindset. I would say the mindset is changing, and the guilt is going. Where you don't feel guilty about that you're putting somebody in a care home, but what you're looking at is the best interest of that person and giving them that quality of life, isn't it? Now the
no,
mindsets are changing a bit.
most definitely. I think we've got about 5 minutes left, Samba, before we come to the end of the show.
Okay.
And a couple of more questions. So, Zaid by Assalamu alaikum, great show. What are the lessons learned? It's an interesting question, actually. What are the lessons learned from COVID-19 deaths in care homes going forward to prevent future loss of lives? That's a very difficult question, but do you want to give it a go?
I'll give it my shot to the best I can. The learning lessons are, to be honest with you, I think what everybody has learned from now is obviously to look at, like I said, the wider picture, look at your contingency plans as well, because obviously that was something not everybody was aware. Because if you look at last year, February, when all this was kicking off around COVID and what was happening, like I said, nobody was around, but now we know what we're dealing with. We've got it all planned in. So it's about planning everything properly, raising your voice as well, making sure the government or whoever you're commissioned by is aware of your struggles and things, making sure you're putting those demands in place. And each day is a learning curve. At the end of the day, I don't think there is a right or wrong answer to any of these, because like the new strains are keep coming out, new challenges are coming for all of us all the time. And I think it's embracing those challenges and looking at it and working together. I think the key thing is about all of us working together, not in silos, because I think what's happened right at the beginning was that we were all in silos, wasn't it? Everybody was doing their own thing and reinventing everything, but not coming together as a teams to say, right, we're all in it together. What can we all do to help each other? And I think this time with the pandemic that kicked off this time, things have been really, really different for us, because we're doing a lot of like staff sharing between us, because before it was like, if we give you our staff, you'll pinch it, or they'll go somewhere else, that kind of thing. Nobody wanted to share their ideas, what was working, but what we all have learned is that we're all in it together, and we all got to work together and support each other and get through it. And I think that's really changed. That's been a learning thing about talking to each other and asking for help and support.
Yeah, no, well said, really. Thank you to Salma for giving up your time to come on the
Thank you
program.
for having
Every
me.
blessings, every blessings for you. We are so proud of you and salute you. That's by Brother Javed as well. So thank you
Thank
so much for your time, Salma. I know it's been difficult for you personally, but the fact that you're still out there helping, your colleagues at the forefront, looking after the patients that are vulnerable, that that may not be there tomorrow morning. So as always, it is a Thursday evening. I'm going to just give you a round of applause from my side. So
Oh dear. Thank you.
no,
No,
absolutely, you deserve it,
I
really.
enjoy what I do. I don't know whether you know that I've been in this job for 35 years. I'm probably giving my age
Wow,
away
wow.
now.
I was
Yeah,
going to say,
35
you
years, so it's
shouldn't.
something I
Yeah,
really enjoy.
yeah.
Eh?
Yeah,
Yeah.
no. Thank you so much. And from our side, if there's anything we can do to sort of support you and raise more awareness in terms of COVID-19 in residential care homes, then please reach out to us, because I know people have been focusing on the NHS, but care homes and people that work in there and reside in there have been hit, if more, if not disproportionately, compared to the wider public as well. So on that note, thank you for everyone for joining us, and
Thank you.
thank you especially to Salma for taking time out on
Thank
a
you for
Thursday
having me.
evening to join us. Yeah, absolutely. Please continue to look after yourselves, hands, face, and space. Very important. We have seen the cases slightly coming down, but that nonetheless still means that we need to keep on doing that bit in order for the government to have confidence to reduce and easy lockdown. And at the moment, we are still relatively high, hence why, because this new South African variant, a lot more tighter restrictions when it comes to international travel are coming into effect from Monday, the 15th of February. Please, unless it is absolutely essential, and when I say essential, it's only educational or medical grounds that you are allowed to travel overseas. And if you are coming back from or traveling to a red list country, I would really advise against it unless it's absolutely critical, because it's just not worth it. On that note, please look after yourselves and each other. Until next week, God bless.